Hello, PsychU community, and welcome to today's webinar. Welcome to December of 2020. Today, we are going to be talking to you about COVID-19 and specifically around perspectives of the healthcare provider as the patient. As you can see today, we have two distinguished speakers with us. The first is Alan or Tony Amberg, who is a psychiatric consultant liaison at Northwestern Medicine and a psychiatric nurse practitioner. Tony is one of the first full practice authority APRNs in Illinois. He is a board certified psychiatric nurse practitioner who has served as a consult liaison at Northwest Medicine in Chicago for a while, where he has been recognized in 2019 for excellence and Hero for Better for his resilience work with the staff during the COVID-19 lockdown. Tony also has a private practice and is past president of the Illinois chapter of the American Psychiatric Nurses Association and is currently the co-advisor for the PsychU Nurses Corner. Dr. Sloan Manning is the medical director of Novant Health Urgent Care and Occupational Medicine. He is also the co-advisor of the PsychU Primary Care Provider Corner and is located in North Carolina. As you know, this program is paid for by Otsuka as well as Lundbeck, and both of our speakers are paid consultants. Myself, I am the Medical Science Liaison with Otsuka, and I also am an employee of Otsuka. So let's get started. Today, we have three objectives. We are going to discuss the personal experiences, the residual symptoms, and the long-term effects of COVID-19. We are going to explore the personal psychological impact of receiving that actual diagnosis. And then finally, we're going to try and understand the personal stigma associated with getting a COVID-19 diagnosis. And the two gentlemen that you see here with me have unfortunately been diagnosed in the past with COVID-19, and they are going to discuss, as being healthcare providers, what it was like to be the patient. So as we kick things off, Dr. Manning, would you please take the first slide, which is COVID-19 overview?
Sure. This is just a brief summary slide. The SARS-CoV-2 virus, or COVID-19 virus for shorthand, is really an RNA virus that is a kind of a positive sense virus, which means the genome is actually messenger RNA that just in the human cell just goes directly into protein synthesis. It's one of the reasons why viral loads have been so high so early in the course of clinical illness. The primary symptoms: fever, cough, shortness of breath, loss of smell, but really fatigue and some inflammatory symptoms that we actually probably might just mention as some of the long-term issues in having this infection, and how the infection is not just a short-term infection or short-term illness, even in people who have mild illness, but the effects can linger and can be very impacting and frustrating and just difficult to recover from for even folks, again, who began with mild illness. This has been a pandemic officially in the world since early March. The numbers of cases that we see is in flux. We're currently in an ascending sort of case report pattern in the US right now. Morbidity and mortality rates shift over time as we essentially have peaks and troughs in the case rates, and as our ability to treat and hopefully in the near future prevent the illness sort of are factored into the equation. So it's an evolving story that everybody listening probably knows pretty well.
Yes, we've had a number of PsychUs that have addressed some of these additional issues, so thank you for covering that in a succinct and summarized manner. So let's actually get to a little bit more of the meat as to why we're here today. We're actually here to talk about both of you, and specifically your personal experience, and have a discussion around what kind of impact this has been on you as a healthcare provider. So as we advance to the next slide, Tony, would you start us off, please, sir, with addressing these particular questions, and starting off with, how did your COVID-19 diagnosis come about? We'll ask you these questions, if you don't mind, and then we'll transfer over to Dr. Manning, but we'd like to hear from you first.
Sure. Good morning, everybody, and greetings from the shores of Lake Michigan. It's great to be here with you, and it's worth recalling that December 1st, by the way, is World AIDS Day. And so the reason I want to bring that up is just to remind folks that we've gone through a pandemic before in the not too recent past, one that caused terrible destruction and havoc, and we came out the other side. And we came out the other side with a better medicine and just amazing. And so we're going to come through this too. And I just want to start on a message of hope. We are going to come through this too. Had my own diagnosis come about. So I was working in the hospital. I was doing resilience work with the staff and out in the community, also doing some work. But the community work was all telehealth, and the resilience work didn't actually take me into a room with a COVID patient, but I was in all of the COVID units, the ICUs, the medical units, working with staff, as well as the non-COVID units. And so I was doing that from the beginning of March through May. And about mid-May, I had a weekend where I just kind of, I don't know, wasn't feeling quite right. And, went to work on Monday, came home Tuesday morning, woke up, again, just didn't feel good. It wasn't anything I could just put my finger on and say, this is what's going on. My temperature wasn't really significant. It was kind of flickering in the low 99s. But I decided to stay home. And that night, Tuesday night, I started spiking fever. And the fevers got worse and worse for the next several days, topping out on Saturday at 103.9. Terrible chills, fatigue. The cough began around Thursday night, Friday, becoming very severe. It was funny, the first couple of days, I thought to myself, oh my God, what have I gotten here? Because, I've been so careful, right? So it couldn't be COVID, could it? By the third day of the fever, it seemed pretty clear that's what I had. I went to the emergency room on Sunday because I was very concerned about my fever and I needed answers, right? I didn't know how to take care of myself. I didn't know something as simple as start taking acetaminophen, every 4 hours to keep from breaking fever. I wasn't sure what medications to use. So Sunday, went to the emergency room. They took a look at me. I was kind of on the cusp of whether I should be admitted or not. Oxygen saturation's around 90%. And I decided to go home because my husband also started spiking fevers and developing COVID the exact same night I did. He had a different illness. He lost his sense of taste and smell, extreme fatigue, but could not sleep at night. And by Sunday, so this was Sunday night, I was having tremendous problems with bouts of racking cough that really inhalers, cough syrups didn't matter. I was having a very difficult time. Monday, went back to the hospital, felt like I couldn't breathe. And there I stayed for the next 6 days. My liver started to have elevations and transaminases. And by Sunday, I was headed home, and now I had to take care of a sick spouse. Then I was out of work because I was one of those people who lingered with positive test results from swabs. And that went on for about 6.5 weeks. I have had that swab up my nose, probably 10, 11 times by this point. I'm sure glad they're coming up with things that are less invasive. So that's a little of my story there.
Great. Thank you, Tony. Dr. Manning, how about you? How did your COVID diagnosis come about?
I kind of got my COVID infection at home. Medical centers have been, I'm sure like Tony's medical centers, just scrupulous about, hand washing and distancing and masking and personal protective equipment and things like that. Turned out I wasn't masking at home, and my wife got sick and caught the virus from a friend. I saw her with fever for a couple of days and wondered myself. I actually had a reference lab home testing kit at home that I had an opportunity to test myself and send off. I had what would be described as a mild illness. I had 2 days of fever, never more than about 100.5. I had a cough for 4 days that I, used an inhaler for. and lost my sense of smell for about 2 to 3 weeks. But the fatigue was unrelenting.
Yes.
It's something that's very hard to describe. And one of the things that I realized is sort of looking back at it is that I'm a walker, and the more that I stayed at home, sort of on my couch, unable to do anything because of the COVID fatigue, the more I deconditioned in a cardiovascular sense. And so, a couple of months later, I was clawing back my life by taking 5-minute walks, not at a huge pace, just to retrain my body. And I have an inflammatory arthritis for which I inherited the tendency, psoriatic arthritis, that absolutely flared during the illness. And, that's not completely gone away right now, although I'm back in my walking program and I have my, sort of sense of energy and stamina back. But this is 4 months in nearly for me. And I'm still having arthralgias, and I'm just now back to what I was in terms of my ability to exercise, aerobically for 30 minutes, 5 or 6 days a week. You pile that on, and I'm sure Tony has this experience too, this idea of, trapped at home and ill with life going around and responsibilities there. And, just layers on top of each other. I mean, you just start having a very difficult time getting life done in general, and the sense of when is it going to be over, and I'm sick and tired of this, and I'm angry about this. And so the human response to an illness like this tends, I think, to complicate how we adapt and how we regain our resilience.
So it sounds like, Dr. Manning, you had more of a mild case as compared to, say, Tony, who had a more
Officially, yes.
yeah.
I
Not having to go to the
wasn't in the
hospital.
hospital. Wasn't in the
Right.
hospital. Tony had the
Yeah.
big guy. He had
Yeah.
the in the hospital thing.
And I just want to mention, to build on what Dr. Manning just said, I think the things that are really intense about it, and I had certainly not the most severe disease, but my oxygen saturations dropped into the low 80s, and I couldn't change position without tachycardia, without long bouts of coughing that would take literally knock me flat for 20 minutes at a time. But it is afterwards the sense of fatigue and the isolation and the deconditioning really resonated with that, because as we start to move into our next question, I found I had to do a lot of reconditioning, and that was a very important part of the recovery. He mentioned the difficulty doing small things. I mean, one of the biggest things that we had to deal with was the dog, because none of the places where we would board the dog would take him. I said to them, I called them from the hospital because my husband was becoming increasingly unable to get the dog out, and nobody could come to the house. No walker could come to the apartment. And I said, look, this is a virus that's very susceptible to soap and water. Would you just take the dog inside and put him in a vat of soapy water, and then you're good, right? The manager called me back and said they had employees who threatened to resign if they took the dog. Wanting to get home health. I mean, I came straight out of the hospital, barely being able to stand up, to come home to have to take care of a sick spouse, right? So all of a sudden I had piles of laundry to do, and the kitchens and bathrooms to sanitize, and food to take care of, and I couldn't get help. Called all of the home health agencies. There were only a limited number of people who would be willing to do COVID, and none of them were available. They were all booked. I can't imagine how people get through it alone. I mean, boy, my hat is off to all of you who are going through this alone.